8 of the 9 Bay Area counties require everyone, regardless of vaccination status, to wear a face mask while in public indoors. The only county not doing so is Solano County. Now the Napa-Solano Medical Society is urging the Solano County Board of Supervisors to join the rest of the Bay Area in masking up indoors.
We are joined now by the president of the Napa-Solano Medical Society, Dr. Colleen Townsend, to find out why they are calling for this change. So just give us a summary of why you are making this decision based on the fact that the Board of Supervisors don't feel it's necessary.
Good evening. Thank you for hearing this perspective. The medical board for the Napa-Solano Medical Society strongly feels it's important to encourage mask mandate in order to stop the spread of COVID-19 in Solano and the remainder of our surrounding counties. We recognize that masks help protect both vaccinated as well as unvaccinated, most importantly, the unvaccinated folks, for whom there seems to be a much higher rate of infection at this time. We've seen a massive increase in our hospitalizations related to COVID over the last 3 months, since June, when the rates were relatively low, and they've really increased almost 7 times since June. And so we'd really like to see the decrease in the spread of COVID-19 throughout our communities.
Talk about that a little bit further on the numbers you're seeing. How are you guys doing on ICU bed space? What kinds of people are getting infected? Are they all unvaccinated? Just give us a thumbnail of what's going on in Solano County.
The majority of people who are becoming infected at this time are unvaccinated, and it's generally younger people, generally in the under 30 populations, more so than the older populations. We have a pretty great vaccination rate for the older populations. And so we're seeing unvaccinated folks who are younger and not getting more infections and becoming hospitalized at a higher rate than was seen in previous surges.
Have you already talked with the Board of Supervisors about your concerns? And if so, what are they saying, since they are the one making this call?
Yeah, we've not actually had a conversation with them. We sent a letter to them urging them to consider the opportunity of a mask mandate for this county, only just as recently as this week. So we're hoping they'll take that into consideration as they think about the broader perspective of how to take care of our community during the COVID surge that we're seeing right now.
Aren't these decisions made by the county health officer? Is that the person who makes these decisions? And are you asking the board to overturn the health officer's decision?
I think we're actually asking for a conversation to happen at the level of the Board of Supervisors in conjunction with the public health officer to take all factors into consideration. We're a group of community physicians who hope to see the levels of the surge really decrease rapidly as opposed to continuing to increase over the upcoming months.
There's been some concern expressed that these mandates could hurt businesses in your community, and that was one of the reasons why they voted against mandating masks. Do you have a sense of what the public sentiment is?
You know, I would say that while some businesses may feel it's difficult to enforce a mask mandate, I think that there's lots of people in the world who actually just follow rules. And the businesses may not need to enforce it, but having a sign and a community standard allows the businesses to operate with protecting themselves, their own staff, and their other customers. And I'll say, as a colleague pointed out recently, we have seen lots of signs that say no shoes, no shirts, no service. And really, there's been no pushback against those signs. And I'm not sure that we have a lot of science backing those signs, but there's a fair amount of science backing the notion of mask mandates protecting unvaccinated folks in our communities.
So we're out of time now, but real quick, so you're going to send a letter to the Board of Supervisors. What's the next step, and what are you hoping to get done?
So the Medical Society is, again, a group of community physicians hoping to provide information and influence into the Board of Supervisors that can give them information around how we feel it's best for them to proceed with regard to this mask mandate. Next, I imagine we'll either ask to participate in the Board of Supervisors or have conversations with them. And we will encourage, most importantly, our patients to wear masks in the community and to become vaccinated.
Dr. Townsend, thank you for your information tonight, and we'll be following any developments out of Solano County in light of the issues that you're raising. Thank you.
Great. Thank you for your time tonight.